नमस्कार दोस्तों, myself Dr. Vivek, practicing as an allergist at Dhanvantari Allergy and Asthma Clinic, Motihari, Bihar. Today, I am going to talk about allergic rhinitis. So, I hope you all are aware with the basics of allergic rhinitis. So, allergy can affect in any organ of our body. If it affects our nasal system, then it's allergic rhinitis. Similar way, we have allergic conjunctivitis, allergic bronchitis, allergic bronchial asthma. So many varieties are there. And the importance of allergic rhinitis is it's frequently associated with allergic conjunctivitis and allergic asthma. So what causes it or what triggers it? So there can be different allergens. Allergens are substances, proteinous substances, which in very invisible amount, they behave as an aeroallergens through air. They enter our nostrils, causes inflammation by triggering the allergic pathway. It can be pollens, it can be fungal spores or molds, it can be some irritants. So irritants and allergens are different. Irritants are like smoke, change in weather, change in temperature, change in humidity. Allergic rhinitis can be of broadly two types, perennial and seasonal, depending on which duration of year patient is suffering. So if a patient is suffering from perennial allergens like dust mites or grass pollens, patient will have symptoms throughout the year. If he is suffering from some seasonal allergens, then only in those seasons patient will get symptoms. What are the symptoms? Like sneezing, especially multiple sneezing, running nose, nasal congestion, nasal blockage, sore throat, and associated symptoms can be running of watering of eyes, redness of eyes. Often there is sneeze, there is itching over nose and associated itching over throat, ears, itching over eyes. So we have different kind of treatments available, like nasal sprays are there. So we have intranasal steroids. Different molecules are available in market. Some are plain steroid nasal sprays. Some comes with agilastins. So agelastin ones are bitter in taste, but they are more powerful and often used for shorter duration, just to control the symptoms in beginning. And once patient is under control, you shift to the plain steroid. Then you have antihistamines. Depending on patient's job profile, you can choose. Some are more sedating, some are lesser sedative. So depending on job profile, you choose whether you are giving levocetirizine or pesoratadine. That again your choice. So what is the treatment? The most important and most successful treatment is called immunotherapy. So what is immunotherapy? In immunotherapy, we give the causative allergen in denatured form in form of medicine. Suppose patient is sensitized to dust mites, we'll do a skin prick test, we'll see the flare reaction, and if you get a very good flare and wheal, and the specific IgE is highly positive, you can go for immunotherapy. So suppose patient was allergic to dust mites. So there are different kind of dust mites. Like we have DPT, DF, then we have storage mites. So suppose patient is allergic to DPT. So patient has to take denatured form of DPT subcutaneously. That is called subcutaneous immunotherapy. Or you can give sublingually. That is called sublingual immunotherapy. There are different regimens are there. We follow generally subcutaneous immunotherapy in our center. So on first visit, I gave 4 units. On subsequent visits, I go on increasing by 4. So second visit, 8 units, then 12 units, like so on. we go on increasing the dose of allergens. It's a long-term treatment. Effect starts appearing in about 1 year, and the total duration of subcutaneous immunotherapy is of about 4 years. After completion of 4 years, most of the patients were able to uh, stop using their intranasal steroids. They were able to stop using their oral antihistamines like that. And in rare cases, polyps associated, DNS associated is there. So surgical correction is required, but very few cases. Then some cases you have to refer to ENT if some associated ENT problem is there. So allergic rhinitis is a very important topic because it's a one airway, one disease problem. So our airways are starting with nostrils and through throat and till alveoli. There is one airway, one disease. So 40% of allergic rhinitis patients, if you don't treat them properly, chances are there they will develop asthma in later ages. And that too within 2 years. Most of the patients develop asthma within 2 years. If after 2 years they haven't developed asthma, that means chances are very less. In 60% of asthmatic patients, allergic rhinitis is a concomitant problem. So if you just treat asthma and you forget to treat allergic rhinitis, patient won't get 100% satisfaction. So you always look for signs and symptoms of asthma in allergic rhinitis patients, and always look for signs and symptoms of allergic rhinitis in your asthma patients. And you are the better judge to like which kind of intranasal steroids you want to use, which kind of antihistamines you want to use, and you have to pick the allergens. You have to suggest for avoidance of irritants, and vaccination is very important. So, like influenza vaccination is there, pneumonia vaccination is there, sublingual bacterial lysates are there. So you have to use them, and you have to give these medicines for a very long time, and there is no limit like how much and for how long you can go on giving intranasal steroids. So till your patient gets complete relief, you have to go on giving your intranasal steroids. They are very safe and absolutely free from any side effects. I think that should be for today's meeting. Thank you.